professional musicians, this concept of shelter in place is not something that we are very familiar with unless we are practicing.
We love being on stage and bringing joy to the community, but right now, the best thing we can all do is stay inside.
And the most important harmony that we can create
is unifying together to shelter in place.
The sooner we beat this thing, the sooner we're back on stage bringing music to the crowds.
And if we can do it, so can you. Let's beat this together.
This is a message from the government of Bermuda.
Today, I'm joined by the Minister of National Security, the Honorable Wayne Keynes, the Minister of Health, the Honorable Kim Wilson, and the Chief Medical Officer, Dr. Cheryl Peak Ball. Before I get to my substantive remarks today, I would like the Minister of Health to please give an update on the latest testing statistics for Bermuda and also other issues related to the management of this virus. Minister?
Between yesterday and today, there were 636 test results received by the Ministry of Health, and one was positive for COVID-19. Bermuda now has recorded 111 total confirmed positive cases. Their status is as follows. There are 57 active cases, of which 43 persons are under active public health monitoring and 14 persons are hospitalized. A total of 48 persons have now recovered, and the total deceased remains at 6. The average age of all of our confirmed positive cases is 59, and the age range of all positive cases is from 18 to 95 years. The age of persons hospitalized ranges between 57 and 91 years, and the average age is 75. Overall, Bermuda has now conducted over 2,000 tests, which gives us confidence that our status remains at local transmission with clusters of cases. We do not have widespread community transmission, which will give us all relief. Our suppression measures are showing success and are working. As of today, we have tested 118 care home residents and 149 staff members from 5 different care facilities. Of these, 226 have come back negative and 41 positive. Of the total number of positive tests at care homes, 22 were asymptomatic individuals. In addition, the residents and staff of Matilda Smith Williams were retested following initial testing, which occurred 2 weeks ago. We retested because there was the outbreak, as we've reported, at the home. We needed to retest all patients and staff in order to determine if anyone had transitioned to positive and how to appropriately staff the home in light of staff and residents' COVID-19 status. Since the original testing, we had asymptomatic but positive staff caring for positive elders and negative staff caring for negative elders. Of course, all of them have been using full PPE regardless of their status. Retesting helps us to better decide how to integrate individuals. Additionally, some who underwent the initial process of screening may have had no symptoms, had a low viral load, and therefore may not have been identified as positive at that time. This second screening will catch anyone who may have transitioned to positive. As I mentioned previously, testing is just one measure that we use to stop the spread of COVID-19. Another very important mitigation measure is contact tracing. Therefore, we have steadily increased our capacity for contact tracing. Staff from various other areas in the government have been enlisted to assist in this regard, and we now have 6 groups of 5 contact tracers. Furthermore, we are looking to train some additional essential workers to contact trace. It is also important to remember that a negative test result tells you your status at a specific point in time. It does not mean that you are immune. It does not mean to stop washing your hands or wearing a mask. It means that right now you do not have an infection, but you still have to take all of the precautionary measures to ensure that you do not contract it in the future. On another positive note, My staff have reported that our new non-contact thermometers, which arrived last week, have been excellent and are much easier and quicker to use than the ones that they were previously using. As we expand on testing to support the island getting back to work, Helix Lab and BGMD Lab are in the process of implementing antibody testing, which will be online shortly. Regarding those who are in the government quarantine facility, this week we are implementing a new over-the-phone mental health screening tool to monitor and ensure their well-being. The calls are made by nurses from the Ministry of Health who will reach out to the Mid-Atlantic Wellness Institute if they identify someone as needing help. We recognize that some may find the quarantine experience traumatic and stressful, and we want to assist where we can in this regard. As the Premier will indicate shortly, we will be slowly and gradually beginning a phased reopening, but the Premier will provide more details of what that looks like and the parameters and all the particulars in a few moments. However, it is absolutely clear and essential for everyone to understand that this is not a return to normal pre-COVID life. In fact, the world and Bermuda will not experience life as normal for the foreseeable future. As we enter in the next stages, all of us will have to continue stringent physical distancing measures to avoid returning to a shelter-in-place scenario. Please remember, as soon as the rate of transmission goes up or hospitalizations start to increase, restrictions will be needed again. So everyone's adherence to physical distancing requirements will be fundamental for our survival. The physical distancing requirements have been broadly circulated and include wearing face masks in public, particularly in grocery stores, pharmacies, gas stations, and anywhere where you are in close proximity to others, practicing physical and social distancing, which means leaving at least 6 feet between you and others, and practicing respiratory hygiene, such as covering your coughs and washing your hands, often with soap and water, for at least 20 seconds, or in the absence of soap and water, use hand sanitizer. Remember, I wear a mask to protect you, and you wear a mask to protect me. I don't want to sound like a broken record, but I have to restate that health will recommend the reinstatement of suppression measures if trigger points such as increased hospitalization admissions or increased cases of COVID-19 are identified. Lastly, as we prepare for the next phase of our level of preparedness with respect to sheltering in place, we need to remember that there are members of the community for whom it is still not safe for them to leave their homes. These are our vulnerable populations, people who are at higher risk of severe illness from COVID-19. These people include people undergoing cancer treatment, people who have had organ transplants, people with severe respiratory conditions, women who are pregnant, people who are severely obese with a BMI index of over 40, and people with poorly controlled chronic conditions such as heart disease and diabetes. If you or someone that you know has any one of those conditions, then you need to help to protect yourself from exposure of the virus by continuing to shelter in place. And I know it's hard, but please continue to stay home. Likewise, if you know anyone with any of these conditions, whether it's a friend or a family member or some other member of the community or a neighbor, please ensure that you help them to shield them as well from potential infection by assisting them in any way possible so that they can continue to stay at home, to be protected, and do not need to go out for any other reasons. The shielding measures must be taken by vulnerable individuals, and they are: stay home at all times. This means no trips to the grocery store or the pharmacy. Ask a friend, a neighbor, or family member to bring you supplies where possible, or use delivery services if you can. Most pharmacies on island are offering a delivery service, so you can contact your local pharmacy to make those inquiries. Minimize all non-essential contact with other members of your household. Avoid any face-to-face contact, and strictly avoid contact with someone who is displaying symptoms of coronavirus, which include high temperature and new or continuous cough. And do not attend any social gatherings. Visits from those who provide essential support to you should continue. However, caregiving and healthcare professionals should stay away if they have any symptoms at all of COVID-19. And all people entering into your home should wash their hands with soap and water for at least 20 seconds on arrival to your home and often while they remain in your home. And all of this advice can be found on the website at coronavirus.gov.bm. Thank you, Premier.
Thank you very much, Minister of Health, for that excellent report. And certainly, I think that we're all gratified to hear the news from the Ministry of Health regarding the fact that we have managed to, in their estimation, get us to a point where we did not reach a place of sustained community transmission, and we still have local transmission with a cluster of cases. And that is certainly, in no small measure, not only to the work of the team at the Ministry of Health, but the work of all of the government officials, and certainly our Bermudians who obeyed the rules. To borrow a phrase that has become popular in this pandemic response, we have come to the end of the beginning. As I indicated when we started the last 2 weeks of shelter in place, this period will end on Saturday morning, May 2nd. This has been a period of change in how we live, socialize, worship, and work. Whatever we have achieved from a public health perspective is because of public compliance. The people of Bermuda have listened and taken on board the significance of this threat, and we have together done what was necessary to protect the most vulnerable and to ensure that our healthcare system can cope with the additional demands for its services. In a marathon session yesterday, Cabinet discussed and considered each and every aspect of how we can best transition into the next phases of this pandemic response. Decisions were informed by presentations from the Ministry of Health and detailed public health advice about how to continue to mitigate the risk of any community spread of this virus while attempting to breathe additional life into this economy and to provide some emotional relief to people who have complied with the demands of this ongoing fight against COVID-19. The decision to end shelter in place was not made without scientific advice. And the change in the manner of which we should go about our daily lives should not be seen as a radical departure from the measures that we put in place to suppress the change of this virus. Social or physical distancing is more than just words. It is key to our survival, and it will have to be our new normal, and it will not change for the foreseeable future. We must get Bermuda working again. We must get Bermuda enjoying life again, but we must also be mindful that we cannot and will not place the health and safety of our senior citizens in jeopardy. We have adopted a strategy for a phased reopening of our economy. These 4 phases set out how we will progress through this ongoing pandemic response. It is important to note that there are no dates attached to phases 2, 3, and 4. This is because how we progress is directly dependent on how well we comply and how we see our hospital and population being affected. That means that the more we have compliance with the rules that are laid out in a particular phase, and we keep transmission of the virus at bay, the quicker that we can move to subsequent phases. We must remain flexible on these matters because the lesson of other countries is that we must always be on guard for any new assaults or second waves of this virus. So, what I know all of you want to hear, this is what you can expect with phase 1, which begins on Saturday morning at 6 a.m. With some modifications, we will essentially be returning to where we were on April 3rd, before the shelter in place was established. Shelter in place will end, meaning that it will no longer be illegal to visit another household. However, it is strongly encouraged that persons do not visit other households, especially, as the Minister of Health said, households with vulnerable persons. A curfew will remain in place between the hours of 10 p.m. and 6 a.m. Gatherings will be limited to no more than 10 people. Retail businesses and restaurants will be permitted to open between the hours of 7 a.m. and 9 p.m. with only curbside service or home delivery. It is important to note that even with the end of shelter in place, businesses outside of those that will be able to operate, such as retail and restaurants, still are subject to the mandatory work from home provisions inside of the law, and those businesses must remain closed if employees cannot work from home. Grocery stores and gas stations will remain open under the current conditions, and days of shopping will continue to be prescribed so that stores are not overwhelmed. Construction, mechanical, and landscaping services can reopen with strict social distancing. Guidance will be released, and any business or job site not adhering to that guidance will be closed. Wholesalers will be open with social distancing to deliver food and supplies as they were now. Funeral services will be permitted with strict social distancing and a maximum of 10 persons indoors or outdoors. The public service will continue to work remotely, but limited cashier counter services will reopen on Monday, May 4th for such areas as TCD, the Office of the Tax Commissioner, and the cashiers on the ground floor of the Government Administration Building and at the Dame Lois Brown Evans Building. As more counter services or front-facing services come online, they will be announced. The courts will open and will operate with appropriate social distancing. Banks will be permitted to operate with minimum operations and social distancing. Trash collection will continue, and I'm pleased to advise that public drop-offs at Tynes Bay will be open on Saturday. Laundromats will continue to operate under the current restrictions, and that is important to note because prior to the shelter in place, there were not those restrictions in place. However, they will be permitted to operate only between the hours of 7 a.m. to 9 p.m. As is now, only one customer or family will be allowed in the laundromat at any one time by appointment only, and wash and fold services may be provided as long as customers do not enter the premises during the drop-off or collection of their laundry. Parks, beaches, the railway trails, and golf courses will reopen. However, golf clubs and any sporting club building will remain closed, and all activities will have to follow social distancing. Limited public transportation is set to resume on Monday, and the schedule will be advised on the coming days. Schools at this time will remain closed. Prison visits will remain restricted. Hospital visits and visits to seniors' homes will remain restricted as they are currently. Church buildings will remain closed. However, limited access for electronic services will continue. There will be no scheduled commercial flights at L.F. Wade International Airport, and all of the businesses that were subject to the closure orders in late March, such as gyms, bars, salons, spas, and barbershops, will remain closed. As we move forward, we are monitoring the situation closely, and the government is prepared to adjust these regulations swiftly if circumstances demand it. Simply put, if the country would like to move to phases 2, 3, and 4, now is not the time to tear it. Stay home, move only when you need to, and let's continue to work together to keep the virus at bay. The tremendous increase in Bermuda's testing capacity over the past week has given us the confidence to permit the changes that will come into effect this Saturday. We have received 930 tests from our drive-through testing facility of essential workers, and given the fact that we have not had a confirmed positive result yet, it seems that our collective action has prevented community spread, which is what the Minister of Health had alluded to. This is the first phase of a restoration of our way of life and our economy. And while it may be some time before we are able to reopen our society fully, we are considering what the next phases will look like and when they will potentially occur. Again, our priority is the protection of lives. During this period, we will all need your help to be successful, and I cannot express it enough that we have to maintain our physical and social distance. With every week that passes without community spread, the sooner we can look at what additional phases we can move on to. We have given much thought to what the next phases will look like. And while we will not have full certainty on the strict requirements to what those phases will entail, and as I said earlier, we are not going to give specific dates, I can give an overview, and I know there's a graphic that is going to be released which will get Bermudians to understand what the next phases will look like. We will move to each phase based on the conditions on the ground, and these will be determined by new infections and hospitalizations. If those remain mostly stable, as they have done for the next week, then we will look to move to the following phases. The next phase, phase 2, is entitled Expansion of Services. And at this time, it is planned to add the following services during that phase. First, the reopening of retail floors and businesses with strict social distancing maintained. Second, limited allowance for personal services such as barbers and hairdressers with strict restrictions as mandated by the Ministry of Health. Now that will come as a surprise for some that it's being allowed so early or thought of being allowed so early in the phasing process. But it was a conversation, and I think it was an interesting conversation, which revolved around the fact that we recognize that with the ending of shelter in place, these activities themselves will commence. And it is far better for these activities to take place in a controlled environment where we have regulations which are set out and these establishments are licensed by the Ministry of Health and comply with strict regulations than to let these things take place in households around the country in an unlicensed place where a single person could end up being a super spreader of this particular virus. So that was a consideration of which we had, and that is the reason why we made that particular consideration. Regarding phase 3, which is entitled Moving to the New Normal, at this point in time, it is currently scheduled to have the reopening of schools and childcare services, the reopening and resumption of full government operations, the restoration of full public transportation services, and the ending of mandated working from home. Additionally, in this phase, it is projected that we will reopen church buildings for services and also reopen gyms for services. We have met, we do plan on meeting with our faith leaders next week to discuss and to find a way forward to open our houses of worship along these particular schedules. Phase 4, which is entitled Our New Normal, will lead to the full reopening of personal services such as spas, massage, and manicurists. Dine-in restaurants would reopen. Bars and clubs would reopen. Sports clubs will also reopen, and public gatherings will be limited to 50 persons or less. And during this phase, it is anticipated that we may also be able to see the resumption of scheduled commercial flights. I say our new normal because though these businesses and services will open, there will still be the need for strict social and physical distancing required, strict hand hygiene, strict sanitation, and all of those things to prevent a recurrence of the virus on our shores or retransmission of our virus on our shores. The past month has not been an easy one for any of us, and I am sure that many will welcome the start of this next phase. We are grateful for everyone in our community who did their part to support our efforts to contain COVID-19, and judged by the results, we took it seriously, and collectively, we did a good job. So, from our frontline health professionals to all the doctors, nurses, technicians, support staff, healthcare professionals working at the hospital and the testing facilities, to our essential and critical workers who kept us fed, our public officers who collected our trash, paid unemployment benefits, and kept us informed, to our teachers who worked hard to ensure that learning continued for our children, and to all the people, too many to call by name, who helped to get us safely to this point, you have the country's gratitude, and you have my personal gratitude. Thank you, and now I'm pleased to take any questions that you may have.
Good evening. Minister Wilson, I just wanted to thank you. On the last occasion, there were 2 undertakings given by yourself and the Premier to provide certain information with respect to hospital beds. We received that information within 24 hours yesterday, and that was disseminated publicly on the show. And I'm grateful for your undertaking that you're still collating the information with respect to Helix Labs, and we will get that information in due course. Mr. Premier, as a follow-up to the last virtual meeting of the House of Assembly, you mentioned that you would be seeking to pass legislation which would allow the government to respond to current pandemic and any future similar pandemics or issues without having to request the assistance of the governor to declare a state of emergency. To what extent has the governor impacted and or affected this government's ability to respond appropriately to this crisis? And why do you feel that it is necessary for the government to pass such legislation?
Thanks. That's a good question. The first instance is that other countries have, in a large measure, updated their public health acts, and they have more recent public health acts than Bermuda has. So Bermuda, we have the Quarantine Act, which is a recent act, which is 2017. But our Public Health Act is actually from 1947. So it's originally written, and it's a rather old act. The view was that it is not ideal to remain inside of a state of emergency because of just what a state of emergency mentally entails. And so our view was that we would want to be able to put in place certain measures, such as a state of emergency, in the case of a severe public health outbreak or a severe communicable disease outbreak, where you can have the type of restrictions which are necessary without reverting to a full state of emergency, which in some cases does suspend certain provisions of our Constitution, which is not a place where I think that the country wants to be. In regards to the first part of your question regarding the governor and any challenges that the government has had with the governor, there have been none. Bermuda has a particularly modern constitution, and in these particular exercises of the royal prerogative, as the emergency powers declarations are, as it's something which is given to the governor under the Constitution, he's acted on the advice of the cabinet, and all matters which have been given to the governor have been acted on with the cabinet's advice.
Mr. Premier, in relation to the current unemployment benefits being paid out by the government, many Bermudians have expressed concerns that much of these funds being paid to laid off Bermudians are having to go right back into the pockets of Balco, our 3 major insurers, and our large banking institutions by way of mortgage payment, rents, and bills and the like. This government has already encouraged lenders and landlords to work cooperatively. However, many Bermudians feel that the government's encouragement hasn't gone so far to be able to be effective as between, for instance, landlord and tenants. Based on this, has this Progressive Labour Party government considered taking more stringent legislative measures in order to reduce the cost of living?
The answer to your question, the short answer to your question is yes, and some of those details will actually be revealed. Sorry, the short answer to your question is yes, and some of those answers, some of those measures will actually be unveiled at the sitting of the House when we go back in next week, Friday. But it is a very good question, and I think what I've been very clear at this microphone in saying is that if businesses do not respond in the way which is necessary during this particular time and crisis of a pandemic, then the government will not hesitate to take legislative action. And I think the Minister of Finance has certainly been having conversations and discussions with our banking institutions and our financial services institutions on some particular matters there. And I think on a broader level that we have to recognize that we have to not be afraid to make those particular changes at this point in time. When we have a crisis such as this, it allows an opportunity for there to be a reset. And with my conversations with my caucus colleagues and with my conversations even with members of the opposition and other persons, it is a time that we need to make sure that we make the changes which will have a long-standing effect and not things which will just paper over the cracks. Because our economy, like our economy in Bermuda, just like economies around the world, are set for fundamental change after this. We've seen the change in which the way we've worked. We've seen the change in which things are moving to, it's even increasing the rates of speed of technological advancement, and we need to be ready.
Thank you, Mr. Premier. I think that's a good follow into the next question, which is, with respect to your statements that we've got to revive Bermuda's economy and we're going to have to make innovative adjustments, for example, as you've just stated, legislative changes, does the government have any plans to fast track the legislation that it's already indicated is forthcoming with respect to cannabis and its commercial and or medical use? And if so, when can we expect to see that?
I don't think there's an issue of fast track. I would know that the Attorney General, who has responsibility for that particular policy, had given a ministerial statement in March over what the government was doing going forward with that. And I believe a consultation document will be going out very soon. But I think what we can also recognize is that many departments inside of government have been consumed with managing the coronavirus and our particular response there. So some initiatives which were probably on the front burner before are not as much on the front burner now.
Grateful. On our Burn News series on Monday, we discussed the question on whether or not internet should be considered a necessity and or a right based on how it has been needed for students and residents, particularly in this era of shelter in place and working and studying from home. So given the current situation is set to dramatically alter our way of life for quite some time, do you think, or does this government believe and or have plans to make legislative and or regulatory amendments to allow or ensure that all citizens have access to internet?
I think that for the most part, you'll see that Bermuda has some of the highest internet penetration rates in the world. But during this particular crisis, we have seen an instance where there have not been equal access there. Regarding the particular question which you've asked, it's not something that we've necessarily considered. But I do know that the Deputy Premier has worked with the telecommunications providers to make sure that we can provide access to those persons who don't have it. And I think the telecommunications providers have actually been helpful in making sure that does happen. It does get into a gray area because if there is universal service obligations, and then the question is who pays for those universal service obligations, and you get yourself into a possible free rider problem. But I think that as we move forward, kind of like you look at you can't necessarily imagine a house without electricity and or running water. It's also the same place where you look at the internet and the need when we're in a digital age for those type of services to be there. So has the government considered making that a requirement or making sure it is provided free of charge to everyone? No, we have not. Is it something that we need to explore on how to make sure we close the digital divide? Certainly, yes. But I think the best thing to do in order to make sure, and someone had sent me an Economist article today about how the extended closure of schools actually affects poor persons more than others. And part of the reason is because of their access to digital tools and to digital learning. And I think that's why it's important that we look to make sure that we can return back to normalcy as quickly as possible to get our children back into schools as long as we can have them back there safely.
And on the final two questions, I think it's a nice flow from what we're talking about, education. What steps has the minister or ministry rather of education taken to address students who come from lower income backgrounds who don't, for instance, have access to internet?
Thank you. I think the minister addressed that the last time he's here, and he will be here on Friday. But all students who did not have access to the internet were given packets for work at home, and those were delivered by post office workers, I think, last week. I don't think that was this week. I think it was last week. So we were aware of the students that did not have the ability to work from home. But in addition to that, there are computers which have been donated for teachers. We are securing a large number of donations which will be useful to get Chromebooks. They're scaling up with Google Classroom and other types of things like that. So I think that there will be more progress made in the future. But at this point in time, what has happened for those students who did not have access to the internet, or even students who did not have multiple computers at homes that didn't have multiple computers at home, my home being one, we made sure that we got work packets out to those persons, and the postal delivery persons delivered those directly to the houses.
Question is to try to gain some clarity on the rationale behind enforcing the 10 a.m. to 6 p.m. curfew now that we're lifting the shelter in place. So if everyone is lawfully permitted to be out and about during the day, is there any medical or social science behind the rationale or to support the position that the rate of transmission is affected at nighttime as opposed to daytime? And
actually, there is, and that's a debate that was held in our cabinet. But the fact is that the less movement and transmission and that you have, the less mixing. It's the less likely for there to be parties in persons' houses after hours if there's curfews, et cetera, and it's part of that reason. A social reason is also that, we're not out of this, and it's not a question of we're just going back to normal. So that is part of a social reason. The third reason is it's also a question of conservation of resources, actually, and when we're talking about from the police and other types of places. So the hours were given. So before the hours, stores were required to close a little bit earlier, but as we are reopening restaurants for takeout services, we did go an hour later, and then the 10 p.m. was to go 1 hour past the time that businesses are permitted to open to allow persons to safely close up their businesses and to return home. So it's 8 hours of curfew versus 10 hours of curfew that we had before we went to shelter in place, and 12 hours of curfew that we had, or strict curfew where no one on the roads when we were in shelter in place. But it is, anytime you can reduce the opportunity for transmission to take place, it does impact the virus. So doing that, it does have an impact.
Thank you.
Thank you, everyone. Good evening. Maya Palacio here from Media Maya. My first question is, what number or level of infection would trigger us to go back to the shelter in place?
I may yield to Dr. People, the Chief Medical Officer, to assist with this, but I'm not sure there's a magic number per se. It's an issue of hospitalizations and what we don't want to have adversely impact our medical system. So we've heard from the hospital that having, for example, 5 admissions on a regular basis would be a trigger that would suggest that they're not breaking, but they could potentially break. And so we would have to effectively turn on the valve of suppression measures in circumstances like that. If we saw a spike in cases, if we started to see sustained community transmission in areas, then we would also, that would be trigger points for us to then again turn on the valve of suppression and start having to have more suppression measures as opposed to the mitigation measures. I don't know if you wanted to add to that, Dr. People?
Yeah, that's precisely correct. And I don't have anything particular to add except that there is no easy answer, and it is about what the success rate is of the social distancing. And so there are ways to look at the surveillance information that comes into the office around cases, new cases of positive infections, and also cases of COVID-like illness and cases of increased respiratory illness. So there are epidemiologic measures you can look at, but there's no one answer or one number, as the minister said.
Thank you. And my question again for you, Mr. Wilson, is the one positive result today, how was that transmitted?
That one positive result is local transmission.
Thank you. Honorable Premier, question, how will the new graph you were talking about earlier, how will it differ from the original model?
The new
graph that you spoke about earlier that should be coming out for us to indicate? Okay.
This one? Oh, sorry. I'm sorry, I'm not understanding your question again. I apologize.
I was asking how the new graph, or the graph that you mentioned in your statements, how would that differ from the modeling graph that we have out now?
I guess if we're talking about the revised modeling, I think we had indicated on Monday that we are getting that raw data, and we're actually we're putting it online. So that not only I had a conversation with Dr. Miners and Aaron Evans last night about the certain things which we're trying to put in place, and we're trying to get a dynamic value for getting actually answers to this particular question of, what is the reproduction rate in Bermuda, having dynamic estimates of those reproduction rates and being able to see exactly, and for persons to be able to do those estimates online. What I would say is that there are a lot of factors at play here, and there are some persons who believe that are not necessarily the curve of which we have per se, but I would say the infections of which we expect inside of the community may actually end up being less. And I say that on a basis because we've seen in various other countries that a lot of the infections or the number of infections which they've had in the country has been more than what they've actually expected after they've gone back and done some antibody and surveillance and all the rest. So we're going to have to take a look at that, and that will be fed into the models. And so I think that having it in a crowdsourced fashion where other persons will be able to play around with and do things might actually help to inform the work of the medical community. And a few persons have said that we have some of the best actuaries in the world here that do this type of mathematical modeling all the time. So in addition to our mathematicians and our health scientists, it might also be something that they might find interesting.
And to Minister Keynes, since persons will be allowed to enter others' homes, my question is, will the checkpoint still be in place after May 2nd?
We are still working as to what that will look like. The operations cell of the EMO will be tomorrow sharing with us what the operational plan will look like.
Those are my questions.
Thank you very much.
Thank you very much. Thank you, Premier and Ministers. Fiona McWhirter from the Royal Gazette. We've heard this evening that there have been 5 rest homes where you've been able to carry out testing throughout so far. We heard on Monday, I think at that point it was 4. Can you give us an indication, please, of how long you expect to take for all 21 to be covered by the testing and why it takes that length of time? People may have expected there might have been more by now.
We are anticipating, we've got a very robust schedule for testing. As you can appreciate, the nurses actually have to physically go to the rest homes as opposed to us being able to utilize some type of drive-in facility. We also have to ensure that those members of staff who are present are tested. If they have, for example, 20 persons that work at the rest home, and during the time in which they're testing, the other staff members are on the evening shift, then that would require them having to go back or making appointments for those persons to be tested. It's a very robust schedule, and we are anticipating Monday, Wednesday, Friday testing of each home, completing it by the middle of May.
And you're quite confident then that that's not going to pose any further risk, that it maybe takes another sort of 2 weeks for that to happen by the time the last one's completed?
Well, during that time, there's also going to be retesting. So some of the homes, like you would have heard us speak about today, we retested Matilda Smith because they had previously had their testing 2 weeks ago. And there is evidence to suggest that there may be a need to retest on 7 days. So part of that process of testing the other homes will also include the retesting of the homes that have previously been completed, which is why it will take a little bit longer than we would have liked, obviously, but we have to test and retest.
Thank you very much. And on a similar point, with regards to the individuals who were tested in the government quarantine facilities, if I've got the timeline correct, and please correct me if I don't, they were tested before those individuals or all the residents at the Westmeath care home. Can you tell us why that was, please?
I don't know if the timeline is correct, but I can say that the government decided from a policy point of view that any person that was in the quarantine facility by virtue of them arriving in Bermuda following the COVID regulation order requiring all persons entering Bermuda to quarantine at a government facility, the government decided, principally for the protection of all, is to ensure that before those persons were discharged, for want of a better word, from the hotel, that they also had to be tested, so that if they were found to have positive results, then there would be a requirement for them to continue in quarantine at the facility for an additional 14 days.
Sure, but given that there had already been 2 people had tested positive at Westmeath, it wasn't thought that that should come first?
Well, I don't remember the exact dates. However, you recall, as we've mentioned previously, and Dr. People has also indicated, testing is not the end-all and be-all as it relates to effectively monitoring COVID-19. And as we've presented at press conferences previously, the first case that was tested at Westmeath, following contact tracing and the investigation, warranted that the action that was needed did not warrant for further testing of the other individuals. Dr. People, did you want to add anything to that?
Yes, I think it might be helpful for me to try again to clarify how the prioritization of testing takes place, because it really is sometimes counterintuitive if you're looking from the outside. There are always these competing priorities, and so within the decision-making process there is the issue of what is most important in terms of public health action. What information do you need to get to act on? In the case of an outbreak, it would be information so that you can identify who needs to be isolated, who needs to be quarantined, how do you make sure that the spread is contained, and those are very time-sensitive matters. Comparing what would be happening in a rest home compared to someone leaving a quarantine facility, on the surface, one would say the rest home is a far more vulnerable environment than, say, individuals who are quarantined. These are healthy individuals without symptoms, and they're leaving, and we just want to make sure that they are negative. I'm not certain of your dates either, actually. I'm not saying that a decision was made in that regard with that is limited supplies, preferring to test one group over the other. I'm simply saying that in public health there are often these competing priorities that have to be weighed against each other. In the case of Westmeath, and I think this is a great opportunity for me to try to open up a little understanding around that. The first case ended up being a case that was first immediately isolated and on investigation identified as not having been an actual real risk to the residents in the facility. Contact tracing led us to check the individuals who were working with that first case. But in our view, the outbreak was contained within that small work setting, not a part of the client or resident facility part of the building. The second case was an unrelated case to the first case. And so now you have a second situation where you must contain the infection. You must make sure that spread doesn't happen. So the contact tracing did begin at that point. But what was the tipping point was when there was a clear case of transmission within the facility, case 2 to case 3. When there is transmission within the facility, that is immediate action. All resources have to be put on containment at that point. Before there is a sign of spread within the facility, one can make some very practical decisions around how you allocate limited testing resources, which we were always in that space up until the last week or two. So the answer, I think, to your question is that there is never an easy answer about who should be tested when you have limited resources. But when there is a priority to be made, the most vulnerable population would be given that priority. That's not to say that's what happened in that case, because I don't actually know the dates, the difference between the Westmeath situation and the exit from the quarantine facility.
My understanding was that the people in the quarantine facilities were tested on the 19th, and I think that the Westmeath residents were tested maybe 21st or 22nd, but that is to say I understand that the third case that you're referring to at Westmeath, I think, was confirmed on the 20th. So
correct. And the good news, now that you've given me those dates, is that at that point there was no constraint with regard to testing apparatus. So they would have happened according to the point at which they needed to happen, unrelated to each other.
That's helpful. Thank you very much. My third question, I think, Minister of Health, you mentioned about the antibody testing that we're hoping to come online soon. Can you tell us a little bit more about what we hope that will show? I think particularly with regards to whether or not it's expected to maybe give an indication of the immunity in the population, or if we're not confident that it's going to sort of give that detail.
I am going to yield to Dr. People, admittingly, because that's a conversation that we've been speaking about a lot. But what I can say prior to Dr. People providing any type of explanation as to the usefulness of the test is that both Helix Lab as well as the new lab at Southside under Dr. Weldon will both be utilizing antibody testing.
I'm having all the fun tonight.
What did she say?
There is still quite a lot of, I would say, scientific dispute as to how antibody testing will be used. Certainly in the setting of outbreak control, there is fair amount of agreement that it does not have a role immediately for outbreak control, and that it does not necessarily indicate who is actively still infectious and who has clear immunity to a disease, so that the value of it is not clear at the moment. When the value is clear, it would certainly have a usefulness in the setting of returning to work or being clear who is not at risk, who's not a susceptible part of your population, and also giving a prevalence for how much of an impact a certain disease has had on your population, how many people have had the disease. So the immunity. But at the moment, we don't understand what the antibody levels translate to in terms of sustained immunity and protection or infectivity. So in the immediate sense of managing an outbreak, it doesn't have that immediate usefulness that PCR testing has, which can show an active infection. And even PCR has its limits in that it is not highly accurate without symptoms, and it also does not have any predictive value. That is to say, you can have a negative PCR test today and tomorrow or the day after have symptoms and have a positive test. So they all have value, but within the limits of what the information that they give provides. And so the antibody testing is really more, at this point, in my view, a research tool, which will ultimately be valuable.
That's helpful. Thank you very much. And just with regards to, Mr. Premier, the phases we talked about, with regard the phases of coming out of shelter in place, etc. Is there any minimum time frame for each phase? Thinking in particular things like sports events that maybe would have happened throughout the summer, football seasons, cup match, etc. Given that there's 4 phases to work through, is it a minimum time frame for each?
There is not an actual prescribed minimum time frame. The view is that once you change things, you should give it 2 weeks to take effect, and that's the advice, 2 to 3 weeks. But I don't want anyone to take any predictions from that and say, oh, this is 2 weeks, this is 2 weeks, this is 2 weeks, 2 weeks. That would not be very wise. We're going to look at the conditions on the ground as they exist. We're going to go ahead and take an understanding of what we have from a hospitalization, when we do from the revised modeling, so we can have a better understanding of and feed those particular things, those data points in locally, and then make those decisions then. But it's going to be informed. So I really don't want anyone to assume timelines, et cetera, because it's not the best thing to do. We're going to continue to work. Our objective is to try to get as much economic activity restarted as quickly as possible. It is to do it safely, but we certainly are not going to rush it just so that we can have a flare-up of infections here locally, because that would not be of any help and would have meant that the sacrifices of which we've made, which have been tremendous, would have all been for naught. So we're going to be very careful while doing it, but we certainly don't want to put any timelines on there. And some things, after we examine these things, may move from one phase to another. So that, I mean, it's set like it's an outline so people can understand, so people can plan, and it actually helps to inform our particular planning. So we know the next phase is dealing with what health has to do with personal services and what needs to be done for the Ministry of National Security side to make sure when we're dealing with retail establishments and making sure they're open on a safe basis. And then the Minister of Education already knows what he's going to do with schools, and that also is with public works and also with public transportation and those type of particular aspect there. So it's helpful from a planning perspective, certainly, and it's something, as I said, was a rather long cabinet meeting, but it was informed by public health advice. Also, we've had a lot of comments and thoughts from our caucus colleagues, and I did have a meeting on Monday with the leader of the opposition as well to just get his thoughts, because I want to make sure that in this time when we're doing our best to work together, that we can all understand precisely the direction in which we're heading.
I appreciate that. Thank you very much. Thank you all.
All right, thank you.
Good evening. Premier, this one is directly from you, from one of our viewers as we speak. A young lady, she says she goes to Bermuda College. She's been trying to get a hold of you. She goes to Bermuda College. She's on financial assistance, and she also works 20 hours, 35 weeks in a year at the college. She's unable to get assistance, and she's kind of stuck, and she's looking for some answers from you. How may you assist in that area?
I'm not entirely certain of that. I would say that if she is someone who worked at the Bermuda College and is, I got it. If she's someone who worked at the Bermuda College and had a job that was not able to be done at this point in time because the college is closed, she would be eligible, in my view, for the unemployment benefit, which is being paid out. And so that's it. If she's existing on financial assistance, I think that's something that will happen via financial assistance, but I would struggle to see how someone would be on financial assistance if they're working 25 hours a week. I don't know the specifics of the case. I do know that my office does a very good job of trying to respond. It may be that she's probably sent a message to one of my private social media accounts. I don't actually man my private social media accounts because I'm very, very busy. So there's my public social media accounts, and so I would ask her if she wants to go ahead to send an email to premier@gov.bm, and she can say I was the person that TNN asked a question about, and I'll ask one of my staff to look into her particular issue.
Yes. You've given 4 models, model 1, 2, 3, 4, for
Phases,
return,
yeah. Mm-hmm.
right, to return to normal, but you haven't been definitive, especially with schools and the younger schools, kids. And I'll speak. I declare my interest. I'm speaking for myself. When would be that time frame for opening up nurseries and the whole school system?
Just so we are clear here on this phase document, which has been sent out, phase 1 is the phase which we're going to move into on Saturday. Phase 2 is the expansion of services. Phase 3 contains childcare and schools. Now, whether or not that may be moved up or back is undetermined at this time. There was lots of discussion over that, particularly for persons who have young children, such as myself, but we are not doing things until we're ready to them in a safe and fair fashion. And so we want to make sure that these things are able to be done safely, and based upon the public health advice on those particular things, it was thought that those would be more appropriate for phase 3.
5 weeks, 6 weeks?
Again, Trevor, we're not putting a timeline on anything, and I'm as many times as any member of the media, so I'm going to save all members of the media a question. If you ask me a question of how long will it take us to get to there, you're not going to get an answer. We are going to look based upon what the conditions are on the ground in moving from phase to phase.
We didn't hear car dealers because there are individuals that are waiting to get their new vehicles and they're stuck without transportation. Any time frame for car dealers to be opening back up?
Auto dealers would be considered a retail establishment. Retail establishments cannot have persons inside of their particular retail establishment, but they're able for opening a business. I specifically said inside of my statement when I spoke about construction, mechanical, and landscaping. That would apply for certainly vehicle mechanics as well, but any retail establishment is not allowed to have persons inside of the retail establishment. So someone who's going to do a car, they can drop off their car, have a socially distant conversation with their mechanic about what may or may not be wrong, leave it there, drop off, and inside of their particular operations, they must maintain their social distance. If they don't, as I said, the Ministry of National Security is staffing up in conjunction with the Ministry of Health and other government departments are going to be staffing up for enforcement measures, and these buildings or businesses will be closed if they are not following those particular guidelines and measures. It is important, and it's just very simple. Everyone needs to wear a mask. We need to make sure that we keep this virus at bay, and the only way that's going to happen is if we're wise and do not let our guard down. And I just want to reiterate something that the Minister of Health said. Just because our essential workers have gone through and gotten this test, and so many of them come back clear, that doesn't mean that you're free from COVID and you're going to be, be sick and you're immune and you can go back to not wearing masks and not washing hands and not doing all that stuff. No, it is just a test for that particular point in time. As the chief medical officer said, it's not predictive. You can be negative today and you can be positive in, a few weeks' time. So it's very, very important that we continue to maintain our vigilance and recognize that this is our new normal.
For the Ministry of Health, I want to ask, the Southside Lab, does it fall under your remit, or who does the individuals there answer to?
The Southside Lab is a government lab. Yes, under the government, that's correct.
Okay, so for this particular lab, or either this lab or Helix Lab, when the results come back via positive or negative, who reports and to whom reports to the patient?
That is a very good question that we're working through the logistics now. So, for example, Helix Lab, which is a privately owned lab but has been contracted by the government to provide the first COVID-19 testing, upon receipt of the test results, that information gets fed to the epidemiology and surveillance unit as well as the physician, because those tests are being requested by community physicians, so we already know who the doctor is, or they are being completed on behalf of rest homes. So oftentimes the rest homes will have the knowledge of who the physicians are. The Southside Lab, as you can note, is a number of members of the public that are essential service workers are going down there. We're seeing several hundred a day. Some of them may or may not have a regular physician. So that actually is a discussion that we were having today in the ministry. And I believe it was part of a conversation that took place on the weekend concerning the whole nuances about how we communicate that information to the individuals, particularly in light of the fact that some of them don't have physicians. One of the options that is being heavily explored and positioned is with respect to apps, because you have to sign in to make the appointment. So we're trying to see whether or not we can utilize technology for the result to be sent back to that individual and or their doctor simultaneously. But those are some of the dimensions that we are looking at right now.
And I think, Trevor, it's important to note, and this is just an example of the flexibility of which the government has to have. We've gone from a place where we had just a little bit of tests to a place where there's a lot of tests. And the fact that the process of which we used before, where there's a small amount of tests where everything goes to the ESU and everything gets reported back to doctors, everything has to change. And so the Ministry of Health, the government, and all bodies have been very reflexive to the changing environment because it's very, very important that we get these results out as quickly as possible. So there were some challenges certainly last week on that side of reporting, but I think over the weekend and then further conversations we've had, we've worked out how that process can work effectively. And I think one of the biggest challenges were that doctors were not referring the tests that were happening at Southside, but the form was saying that that people get their results from their doctor, and that was creating a particular challenge. So we've gone through things insofar as refining how that happens, and I think that the persons who get negative results will get their things directly.
For such confidential information, shouldn't it be the doctor transmitting that information to a patient?
That's correct, and that's why we're going through that process now. But often, like I said, if we utilize an IT mechanism, then that information can go directly to the person that's getting the test. Because some people don't have a doctor, or they haven't had a doctor for 10 years. But those are nuances that, as the Premier indicated, that we're working through. I think what's more important is the fact that we have greatly increased our testing capacity for COVID-19 in Bermuda, and that's a great testament to the hard work and dedication of a number of people, and it shows in our statistics as well as the fact that we're able to now remove the shelter in place, so to speak, because we have the capability of doing more testing.
Minister Keynes, can I ask, will the regimen still remain embodied?
That's a good question. That's something that we're looking at now.
What has been the budget thus far for the Bermuda Regiment?
Can you ask the question again, please?
The budget for the Bermuda Regiment since shelter in place, how much has been spent?
There are 120 soldiers that are embodied, approximately. The cost for salaries have been just over $2 million, and there have been just over $100,000 used for operating expenses.
Thank you very much. Premier, we'll go to Bermuda Broadcasting.
Good evening, Mr. Premier.
Good evening, Don. How are you tonight?
Lovely, thank you. And yourself?
Well done.
You mentioned tonight the airport would reopen in phase 4. How will what's happening with our gateway cities and those countries affect the airport reopening?
It will certainly have a big impact. I mean, if air service aren't running from our gateway cities, then that'll certainly be a challenge. But I think it's very important when we say airport reopens, it's an issue of, and we're certainly going to have to update this document as I see it, because the airport is not currently closed, but it's to reopen to scheduled commercial traffic. And so when we're talking about down at that far side, it's about talking about scheduled commercial traffic. So I know that there's a conversation, discussion, I think today, the minister had sent a note, the Minister of Tourism and Transport had sent a note about possibly another charter flight from the United States because there's still a lot of persons that are stuck in the United States, and given that regular commercial air services are not set to resume as quickly as some would have hoped. But it's a fluid thing, and that's probably why it's so far out in phase 4. Because there are lots of different considerations that are a part of that particular process. Not only what happens overseas, but it's also what happens here, what testing might be required for persons and visitors, how you make sure that you're keeping your country, the country safe and not reintroducing new additional clusters. So it's certainly something that is a particular challenge.
Yeah, particularly right now, both the UK and the US seem to be problematic areas in the world with dealing with cases. So even if we were in a good and safe position, if they continue or they're still in that sort of area, would that mean that flights could go out with Bermudians and come back, or no?
I mean, honestly, we don't have those answers yet. I know that the Minister of Tourism has an extensive team, and the extensive team of which the Minister of Tourism has been, I guess, examining all the various factors into what is required to reopen our tourism industry, what are the requirements for visitors to return, what are the types of things which we need to do, are we having enforced quarantine, is there some type of testing? All of those particular things which are under consideration are being worked through. But the fact is that when we're talking about a phased approach, that is something that is certainly further out than closer, because when we have in place where when we're in a place where it seems as though we successfully, for the most part, contain the virus. I'm not saying that doesn't mean we're not going to have more positive cases. We might have a few popping up here and there, but when you start allowing more persons to come in, you introduce the possibility of additional transmission vectors. The policy of the government is not to eliminate the virus completely, but we want to make sure that we can handle very quickly any new cases that pop up. So it might be that, that in new visitor cases, and in a month, if there's an app and there's something else, there's different things. It's difficult to see it's difficult to predict next week, let alone a month away. So it remains to be seen. But the reason why it was placed for commercial services to resume in phase 4 is because that's something that when you're getting back to dine in restaurants and bars and all the rest, it's something further down the road versus, something that might happen sooner.
Off swimming and cycling be affected? And I know, like when we had the curfew prior to that, some people abused the golf angle, and some of those courses were that was shut down.
I sincerely hope that there's no more abuse of that which is going to take place. But as far as the restrictions there, I would say that sports houses, so a squash court is an indoor facility, and an indoor facility would not be able to be open because it would remain closed underneath, and those things were closed before. Groups outside are limited to 10 persons, so if you're playing a full side of football, it's going to be kind of impossible to make sure. We're not there yet, but what I would say is that insofar as running and cycling and those type of issues, tennis and others, as long as persons are practicing social distancing, golf courses are open, golf clubs are closed, and persons just have to make sure they practice social distancing. It'll be on the responsibility of persons, those businesses, to make sure that's enforced, and if it's not, they can be closed. You want to add anything to that?
Golf carts.
Mm-hmm. Oh yeah, I think in golf carts you have to be, I think it's social distancing which is required. So it's either, is the advice no golf carts?
No golf carts.
Okay,
walking.
gotcha. Here we go. A lot of exercise and walking.
Yes. Health Minister, the CDC has long said that fever, cough, and shortness of breath are possible signs of COVID-19. It recently added 6 more conditions: chills, repeated shaking with chills, muscle pain, headache, and sore throat, and loss of taste or smell. Does this make it likely that more people will get doctor's referrals for COVID-19 testing?
I think, it's interesting. I said the other day that the only thing static about COVID-19 is the name, because things are evolving on a regular basis. And as more science develops, we get more evidence that would suggest that it's an evolving issue. As you've just rightly said, there are other types of signs and symptoms that are being identified in patients that have been testing positive. At this point, there are 2 mechanisms in which persons can get tested. One is getting a referral from their physician. So if the list of conditions or has been expanded, such as ones you've just named, and then their physician says that I'd like for that person to be tested, then of course they'll be tested. And then, as I said previously, the other mechanism for testing and availability currently is with our essential workers at the Southside Lab. So we may or may not see increases of requests from physicians asking their patients to get tested. It's kind of hard to say. I think what's important, though, with respect to that, is the fact that we have the testing capability to address that if it arises.
I don't know if either you or Dr. Peak Ball might know. Have we seen people with those symptoms here in Bermuda?
Yes,
Absolutely. In fact, it's not recent that those symptoms have been recognized. Physicians have been referring for those symptoms well before, I would say, well before April, sometime in March. And in fact, the World Health Organization recognized that there were other symptoms, including the vomiting and diarrhea. I don't think you said those, but we've seen people with gastrointestinal symptoms. And so it has a very wide range of presentations. And within the acute care setting, people have been admitted for reasons unrelated to respiratory illness who, when tested, because the hospital is testing all admissions, are identified as being COVID positive. So there is quite a lot of mystery around what all the symptomology could be, and there is very liberal testing at this point. There is, not strict adherence to case definition, but anybody with symptoms that could be mildly connected to COVID-19 are tested. So I don't actually anticipate that there will be a lot more testing, because already for over a month there has been quite liberal testing, only limited by supplies. And now in the last couple of weeks that hasn't been a limitation. So we've been testing broadly, and I don't anticipate there'll be more testing because of the symptom list increasing.
Finally tonight, there with the 2 rest homes with multiple infected patients and anxious relatives, along with quarantine flight passengers, people are waiting desperately for accurate, timely, regular information updates on the website. And over the last 6 days, there have only been 2 complete data updates. And an example of that was the night that the person died at Westmeath. That was the only figure that was updated. Yeah. Government's COVID website in the past 6 days, so why hasn't there been more updates complete and full?
Well, you picked a point in time, actually, and it's somewhat unfortunate and irregular in that prior to last week, you'll recall that the Premier required us to update the website on a regular basis, so that would have included weekends. But fortunately, perhaps as a result of some cajoling from myself, he agreed for us not to be able to work last week Sunday, which would have meant that there would not have been a report. And when we had the press conference on Friday, we indicated that there'll be a report on Saturday, but there would not be a report on Sunday. Because in order to do a report, we have to go into the office. So we were allowed to stand down on Sunday. And admittingly, I will take full responsibility for the absence of a report yesterday, because we didn't come out of cabinet until 7:45. So by the time we left cabinet, I honestly did not look at my phone to see that the report had been, because they won't publish the report until I give consent, and I just did not look at my phone at 7:45.
Thank you very much.
Mm-hmm.
So yes, Don, going forward, we'll still aim to update on a daily basis.
Yes.
But as the Minister of Health said, it was a very long cabinet meeting yesterday, and the team at Health are, they've been running this marathon since January, so I was happy to give them that particular day off, although work still took place.
Thank you. Good evening, panel. Trust you're all doing well. How are you? Premier, I think I'll stick with you today, and I'll try and be brief and to the point, just so we're on the same page. If you can explain to me like a 6-year-old, because there are people out there who heard you say tonight, come Saturday, the shelter in place has lifted. Does that mean we still have a curfew? Does it mean to heck with the shopping list? Because you know how some people are. Just can you speak to me in layman's terms, please?
Okay.
Does it mean Monday I can hang out till 9 o'clock? Not me personally, figuratively.
Ciola, thank you. I think I covered most of those things in my statement, but I'm happy to take the opportunity to reiterate them. Though shelter in place has ended, it does not mean that we are returning to normal life. And I want to be crystal clear that because of the fact that the emergency powers declaration as blessed by Parliament is in place until June 30th, we can change the restrictions at any point in time. And if I see the fact that people are not trying to act responsibly, if they are not adhering to these rules and regulations and just allowing a little bit more, as I say, freedom, this doesn't mean house parties, this doesn't mean do this doesn't mean hang out, this doesn't mean we're organizing something to the beach. The fact is that we are reverting to where we were before, by and large, and that means that restaurants and retail establishments will be open for takeout. The curfew will be in place between 10 p.m. and 6 a.m., But the fact is that you put yourself, your family, and others at risk if you are outside and socializing with persons who are from different households. That is how transmission happens. And that will slow us from cutting to a place of getting to phase 2 and phase 3. And it is very, very important for the country to get to phase 2 and to phase 3. So for our children to be able to return to a learning environment in a safe place, for there to be more persons being able to return to work, to earn money for their families and those type of things, those are the things that are important. And that's why it is critically important. So yes, on Saturday, you'll be able to go to the beach. But on Saturday, if you have a beach party with 20 people, understand the law will say gatherings of 10, and you will be subject to prosecution. It's that simple. I am going to trust, even though a few people laughed at me online for saying that I trust Bermudians do the right thing. I am, but understand, we can change these laws very quickly. The cabinet can say it is not working, and we can revert back to a tighter schedule. So I encourage persons to recognize that though we have done a good job and gotten this far, the job is not yet done.
Say more than once that you don't want to be tied to timelines. So let's do timelines ballpark. Given the fact that schools reopening is phase 3 and that in just over 8 weeks it will be the end of the school year, do you anticipate that classes will start physically in the buildings before the end of June?
I cannot necessarily state one way or the other, and we're not going to put timings on these particular phases. Sure. As I said, we're looking at these particular phases as they are. They give a stage for planning. The Minister of Education, who I believe will be here on Friday, will be happy to answer any particular questions of which you may have on those particular things regarding education. We're not going to put a timeline on these particular phases. We're going to approach them based on what we're seeing on the ground. We are not going to do anything before it is safe to do so.
On parameters, say school opens, it will mean public transportation. Can you give me some idea what will that look like? Because you can't sit next to each other right next to on the bus. Does that mean you're going to roll out mini buses and other things?
Those are lots of things that were being discussed as part of the rollout. That's probably the reason why public transportation is in full resumption of public transportation is in phase 3. But the reason why governments, schools, and public transportation are all in the same bucket is because you really can't do one without the other. And that is one of the things that was recognized and full government opening, because we are going to have skeleton services, public works crews will be out, et cetera. And so that will happen come phase 1. But for full government services reopening, full school reopening, you need to have a full and functioning public transportation system. And we need to figure out what that's going to look like with social distancing.
So with a rollout, and let's say the numbers stay good, and I know we can't do hypotheticals, but I'm hearing that there could be tinkerings that we could have cup match, considering there's 100 million in circulation that time of year. That's with or without COVID or tourists.
I'm not going to make predictions on the future, Ciola. I can't make predictions on the future. What I can say is that the government is not going to do anything, despite what the desires of the leader of the government may be, that are going to put our people at risk.
Any idea on cost to date for the testing at Southside, and how does it, well, I'm guessing essential workers have insurance, but some of them who hustle from one job to the other may not. Any indications there?
You want to handle it? That's not being handled by, as I said on Monday during the remarks, that's not being handled through the traditional process of insurance and reimbursement. So that is being provided free of charge to the end user, so people are not racking up insurance fees, which is cost to everyone, which we have to pay. So the supplies are bought for by the government of Bermuda. The swabs were paid for, I think the swabs, and then there were the machines were donated, some of the other testing kits are a part of it. So on the overall level, I would say, I don't have a particular cost, but I know that there were some questions of which were asked earlier, which were responded to. The lab director is Dr. Weldon. So Dr. Weldon is not of any charge to the government of Bermuda. The lab manager who's down there, he is a certified lab technician who has experience in PCR machines and is actually starting his doctorate degree next year. He's being remunerated at a rate of $60 an hour, which is in line with the lab manager with the central clinic for the government of Bermuda. And then the assistants who are assisting Dr. Weldon and the lab director, I believe there's 3 assistants who are assisting, they are being paid $25 an hour up to a maximum of $800 net per week. The other expenses would, of course, be the consumables and supplies and the government persons who are there assisting with that process. A lot of the volunteers who are down there, the nursing students, et cetera, those persons, they are volunteering for experience on the summer, and they might be a space for us to give them some level of remuneration or consideration for scholarships as we go forward. But I think it's a great learning experience for them. It is a far lower cost endeavor than through the traditional insurance system, because I think I had indicated that the insurers are reimbursing tests at $300 per test. And so we've been able to do a significant amount of tests, and I think that lab has done over 1,000. So if you look at that $300,000 versus the amount of cost which is taken, but I promise that we'll give a full breakdown. I'm not sure if we'll be able to have that for Friday. We might have it for next week, or we might have it, I'm sure that we will have it by the time we go back to the House Assembly next week Friday, whether or not that is there or virtual.
Okay. One last question. Both TNN and I are being hit up with questions. Who exactly in the government line of things, when it comes to certain places reopening on Monday, who's expected to show up to work and who is not? People want to know
from government offices?
Yes.
Government
Will that be posted anywhere?
It is not yet posted anywhere. Government offices will be informed by their particular employers or heads of departments of the departments that is there. That is the standard practice. That's the same practice which we've been going through, and it will be advertised as to specifically which government offices will open. But the ones which we have confirmed opening at this time were, as I had said in my statement, and those would be TCD, counselor services, with strict social distancing, of course, and do not go inside of one of these places. You won't be able to go inside of one of these places without a mask, so don't even try it. But it'll be TCD, Office of Tax Commissioner, and cashiers on the ground floor of the Government Administration Building, and cashiers at the Dame Lois Brown Evans Building. There are no more questions? Excellent. Well, with that, I want to thank the Minister of National Security, the Minister of Health, and the Chief Medical Officer for being here. I want to thank everyone for their questions at tonight's press conference. I just want to reiterate that though we are coming out of shelter in place, do not start planning your real house party that's not on an app on Saturday. It will be a mistake, and the laws that will be put in place will still restrict the size of gatherings. I strongly suggest that you do not think that this is a time for you to revert back to what we had before. The curfew is still in place. It is still legally enforceable, and as I had mentioned, the government has the power to change these rules and regulations at any time. I cannot express it enough that do not tear it. It is essential. It is not the time now to act up. It is now the time to make sure that we continue to be responsible as a community so more of our persons can get back to work and we can get our economy back up and running again. Let us work together to make sure that we get to phase 2. The next press conference will be on Friday afternoon. Tomorrow evening, however, due to the fact that there's a lot of information of which we've laid out, we will be having a live online session with myself, the Minister of Health, and the Minister of National Security. And what we will be doing during this particular session, persons can send their questions to the government Facebook page or to Bermuda Premier on Twitter, and we'll be happy to try to respond to those questions tomorrow evening, and the advertisement will be going up for that just to make sure that we can take any questions that you may have related to this. And with that, I would like to say to everyone, thank you and good night.